Welcome to Chapter 17. Today we'll talk a little bit about drug abuse prevention, and we'll largely be referring to prevention among young people. So, as we've talked about in previous chapters, there are many reasons why and many factors that influence substance use. Substance use does not just happen all by itself. I know in treatment, sometimes when clients are sober for a while and then they relapse, they say, I don't know what happened. It just happened. I just used. And then when we sit down and really look at the context of what happened before the person used, it's called a relapse analysis, that we often see circumstances that trigger the substance use. So substance use does not just happen out of thin air. There's context to it. And that context can include individual factors, social factors, and environmental factors. Individual or internal factors include things like genetics and family history. Now, family history can be both genetic and social and environmental. And also personality traits. Is the young person self-confident? Does the person stand up for himself? How does that person interact with his peers? Is he a leader or a follower? And also attitudes and beliefs. Also important are those social factors. You know, when you're young, peers are everything. How do you interact with your peers? What's going on at the school with regard to policing that environment? Also, how is law enforcement protecting the community? What's going on at home? Is the home life stable? Are the parents involved in the young person's life? And then those larger environmental factors. And we're not just referring to physical or built environments, we're also referring to physical environments, social environments, economic environments, and legal environments. For example, how much do substances cost? Is the cost of tobacco or alcohol, is it prohibitive, or does it make it easily accessible for young people to get? What about marketing? Are we being inundated with ads about alcohol and drugs, and how are those substances being portrayed in the media? Are they being glamorized, or is there a balanced portrayal where the risks and the consequences are also demonstrated? And also important are the legal parameters of what's going on in your state, mainly. Many laws are state or federal parameters. This is simply a graphical demonstration of the ecological model, and the ecological model, it stresses those environmental factors that we talked about: physical, social, economic, and legal environments. And these are each represented with concentric circles. And each of the layers contribute to an individual's decision making as to yes or no, I will not use a substance. Next, let's talk about programs. So, what is it that we hope that prevention programs will accomplish? One, we want to enhance those protective factors, those things that steer us away from substance use, such as self-esteem, self-efficacy, locus of control, parental involvement, alternate healthy activities. If you don't want us to use drugs, then what do you want us to do? Those things are important. We know from the research that being involved in sports and clubs and churches are protective against substance use with young people. Prevention programs also want to reduce risk factors such as delinquent behavior, other risk behavior, aggression, lack of parental involvement, gangs, and poverty. You'll find that poverty is a universal risk factor for nearly all negative health outcomes. We want to address all forms of drug abuse across the lifespan, not just with young people, but also adults and older people. Different age groups come with different life circumstances that maybe make us more likely to be stressed out and having a difficult time coping and navigating with those situations that life throws at us. So, what is primary prevention? In the disease model, we're talking about the host has not been infected by the pathogen. So here with substances, we're talking about the individual has not yet engaged in substance use. And we want to keep it that way. That's what we want to do in primary prevention. We want to keep individuals from ever using. And primary prevention, it implements a broad range of activities, which we'll talk about more, at keeping those non-users non-using. We talked about in previous chapters inoculation strategy. Inoculation is like a shot in the arm, so we're injecting the individual with knowledge about substances, the risks, the consequences, and how the substance affects the body and the mind. We also often pour resources into targeted interventions whereby we're looking at communities that may be at higher risk for substance use, or populations with high risk of substance use, or individuals or groups that are experiencing circumstances that research says that puts us at an increased risk for substance use, such as broken homes, traumatic home lives, and engaging in other delinquent or high-risk behaviors. So primary prevention interventions use many strategies. Some are more individually focused, such as effective education. Here we're talking about emotional literacy. And during adolescence, navigating the emotional environment is often challenging. Even as adults, navigating that environment is challenging. So here we're talking about emotional regulation, being able to identify and process emotions. Next is values clarification. What is important to us? What kind of people do we want to be or become? Also, personal and social skills development, meaning peer resistance skills, conflict resolution, being a leader as opposed to a follower, and then basic drug knowledge, informing individuals about the dangers of using, the consequences, the risks, and the effects on the body and mind. We also implement small group strategies. Peer mentoring is an important strategy used in many public health interventions. There's a great benefit and value to having a peer, somebody that you can identify with, perhaps has walked in your shoes, somebody that you feel comfortable and connected to. And again, those conflict resolution skills at the group level, infusing drug education into standard curriculums in the school environment. Also, clarification of peer norms. Oftentimes, young people tend to believe that everybody is having sex or using alcohol and drugs, and this is just not true. So we want to counteract those perceived peer norms. Also, healthy alternatives. If you don't want us to use, what do you want us to do? So we promote activities that are healthy, sports, civic involvement, church, different clubs, and also strengthening families. Again, adolescence is a challenging time, and Oftentimes there are conflicts between children and parents, just growing up and creating independence. And if a child has the support of their family members, primarily their parents, the support and involvement, healthier outcomes are more likely to happen. At the system level, it's real important that we build collaborative approaches. And here we're talking about parents, schools, churches, businesses, law enforcement, local government, community-based organizations, and the media, that we all come together to create a culture that supports healthy decision making and values our young people. Next is secondary drug prevention. In the disease model, the host has already become infected by the pathogen. So the individual is already engaging in use of alcohol, tobacco, or other substances. Our aim here is to reduce or stop the use in order to prevent progression to substance use disorder or addiction. In secondary drug prevention, it's important that we appropriately assess and identify what's going on with the individual so that we can intervene as soon as possible. Early intervention is better. And we also want to make sure that the individual sees the consequences in both the home and the school environment for breaking the rules or for engaging in such risky behavior. We want to see that the individual understands that there are social, legal, emotional, and physical consequences to substance use. We also want to make sure that the teacher, the parents, and the counselor are all on the same page, ready to rally around the individual to support them. And the counselor may be a school counselor, or it could be some outside clinician. In today's healthcare model, it may be the primary care physician who is seen first and then referred out to some mental health clinician. We also want to make sure that our young people know of alternative choices to make. If you don't want us to use, what do you want us to do? And also the use of peers, perhaps peers that have used and recovered or are in recovery from substance use. Next is tertiary drug prevention. Here we're talking about rehabilitation. So the disease has progressed to a diagnosis of substance use disorder. So again, we want to appropriately assess and diagnose the individual so that we can refer them into the appropriate treatment, and there they will receive substance use treatment and also case management services. And case management services are those legal, medical, and employment wraparound services in order to skill build and help the individual resolve some of those outside issues and also reintegrate the individual back into the community so that the individual can be a productive citizen living to their full potential. Oh, I wanted to add as well that the assessment and referral component, this can happen in many different venues. It may happen with the primary care physician, it may happen within the legal system, or it can happen within some social service model or community-based organization. I wanted to add as well that we often don't know who we're speaking to when we're speaking to a group of individuals. So many types of users may be represented. We may be addressing non-users as well as early experimenters or current chronic users. So sometimes primary and secondary approaches are used simultaneously in order to try to cover as many of the group as we can.